All right, welcome Cannabis community. I'm the moderator. My name is Regina Schoenberger. I am the community educator and cannabis educator at Princeton Integrative Health. This event will be hosted by Dr. Vincent Leonti, founder of Princeton Integrative Health. We have Debbie Trapanese here, a community outreach manager of RISE Dispensaries by Green Thumb Industries, and we have Vincent Mazzeo, patient care specialist. So really great to be with you tonight. Just checking my participants again. Looks like we're still good. So this event is an hour. We might go over a little bit, but if you can't stay for an hour, no worries. I'll be live recording this session and sending it to everyone. I am going to keep everyone muted for the time being. And then the schedule, the way this event will go is for the first 20 minutes, I'm going to talk to you a little bit about the important components of cannabis. I'll talk to you about the endocannabinoid system. We're going to introduce Dr. Leonti and learn a little bit more about functional medicine, what that is, because Princeton Integrative Health is more than just a medical marijuana enrollment practice. We are a fully fledged integrative functional medicine practice. We're going to talk about how Dr. Vinny became a functional medicine doctor. And then we're going to turn the floor over to Debbie Trapanese and Vincent Mazzeo of RISE Dispensary. Really happy to be collaborating with them tonight. They're going to talk to you about RISE, what makes this dispensary unique. They are on the East Coast. This team is specifically from the Paterson, New Jersey location. So they'll be talking about dosage, because with chronic pain, it's a very individualized therapy. Cannabis affects people differently. So dosage, I know, is a major question with patients. We'll talk a little bit about dosage. We're going to talk about the approved forms, what RISE Dispensary, what products they offer, as well as a little bit about their strains. We're going to have a Q&A at the end. I will keep everyone muted, but for the Q&A, if you have a question, just enter it in the chat. Oh, we have another person. And I can unmute you, and then we can field your questions. And then we'll just take a couple minutes to hear from Preston Hall. He's in the building of Cannabis. It's a hemp-derived CBD coupon website and cannabis lifestyle website. And he's going to give us an update on if you're interested in CBD, as well as what's going on in the hemp industry. So let's get into this. Alrighty. I feel like I'm on a spaceship, just handling all these different things at once. Okay, so let's dive right into this. So this is the Princeton Integrative Health team. Here is a snapshot of us. Small family practice. We're located in the heart of Lawrenceville, New Jersey, founded by Dr. Leonti, who's with us tonight, and his daughter, Jenna Richardson. She's a functional diagnostic nutrition practitioner. We've been operating for 3 years now. We offer chiropractic care, acupuncture, health coaching, lifestyle changes. We enroll in the medical marijuana program. So definitely check out our website, princetonih.com. Now, what is functional medicine? Some of us may be familiar with this term. Some of us might have never seen it before. But the basis of functional medicine is that it's getting to the root cause. So I cannot emphasize this phrase enough, the root cause. What functional medicine does is it's understanding prevention, management, and root cause of disease. It's taking school of thought from conventional medicine, which is needed. We know pharmaceuticals and surgery can help, but is that the only method? Is there a better alternative? Now we have the other end of the spectrum, integrative and holistic medicine, which focuses on mind, body, and spirit. And what functional medicine does is they're blending these two aspects. I'm just going to check to see if anyone's waiting, because while I share my screen, I cannot see that. I think I do have someone waiting. Sorry about that. Okay, there we go. Excuse me. All right, so going back to conventional medicine, there's a strong emphasis that is placed on characterizing disorders by diagnosis, and that usually reflects a collection of systems or behaviors rather than the root cause. The focus is pharmaceutical medication and invasive surgery. So pretty much over the past century, this system's been applied to the whole spectrum of health care. But again, is there another alternative? And conventional medicine is definitely needed. There's been many advances over the past century, whether that's ER medicine, which Dr. Leonti has over 35 years experience in emergency medicine. We have the infectious disease medicine as well as surgical intervention. So here are some modalities of holistic practices. Some of us may have used these before. We offer acupuncture. This has been used for a very long time to treat inflammation, chronic pain, stress. Some of us might use these therapies. I personally love music therapy. I'm a big fan of healing frequencies. You should go on YouTube, type in frequencies, put that on while you're sleeping. You'll have the best sleep of your life. Massage, homeopathy. So these are some integrative practices that you'll see that encompasses holistic therapy. And just keep in mind, it's focusing on the mind, body, spirit. Supplementation is a huge part of functional medicine, and it's a systems biology approach. So with that, we have functional medicine testing such as the GI map, which can give you a snapshot of your gut. We have micronutrient testing. You might be deficient in vitamins, antioxidants, amino acids. And instead of going straight to pharmaceutical medication, there is the power of plant magic. So there are a lot of herbs that can target chronic pain, inflammation, as well as stress, because when we are in pain, we're not our best selves. We're anxious when that next flare is going to come up. Some of these are my personal favorite, like ashwagandha. I love this adaptogenic herb, helps you reduce stress, is also anti-inflammatory, and can help enhance the effects of THC. I'm also a big fan of peppermint oil, anti-spasmodic. I have horrible pelvic pain. I'm a medical marijuana patient myself over the past couple years, and this program has changed my life. All right, so I'm going to unmute Dr. Vinny. Now, Dr. Vinny is in our virtual house tonight. I've been working for Dr. Vinny for 2 years, but I'm also a patient myself, and he has been a godsend in my life. He's helped me sift through all the layers of confusion with my chronic pain, because with chronic pain, we can be misdiagnosed, and he's really put me on this track to wellness. So Dr. Vinny, if you could introduce yourself. He's a functional medicine practitioner. He's has 35 years of experience in emergency medicine, and he is also going to focus on various different chronic pain. Dr. Vinny, if you could just talk to us a little bit about how you became a functional medicine doctor, and how cannabis, how your personal experience with enrolling them, how you've seen it's helped.
Thank you, Regina, for those kind words. Thank you, everyone, for coming here and honoring us with your time. So how did I become a functional medicine practitioner? As Regina mentioned, I spent 24 years in the ER. You know, I saw people at the very worst times in their lives, their crises. And after I had my own health problems, I developed coronary artery disease. Despite being a doctor, despite following what was purported to be the best advice on the subject, I developed coronary artery disease. And that made me realize that conventional medicine did not have the answers. You know, when you have a life-threatening condition, it changes your life, literally. I knew that, you know, I had a condition that could have killed me easily. Many people who present with coronary artery disease, their first, about 33%, sudden death is the first presentation of that. I am so happy that did not happen to me. But I realized if it could happen to me, a doctor, what chance did other people have? They didn't really have the chance, the knowledge, the guidance to avoid that. So I decided that I would go on my quest, my mission to learn how to truly care for people, to get to the root cause of illness, as Regina was saying, to give them the knowledge and guidance to avoid those catastrophic illnesses of heart attack, stroke, and dementia. So that's what led me down this path. And, I would be happy to help anybody who wants to, find out more about that. Be happy to talk with you, or, if people want to register, we can maybe just do a Zoom meeting or Facebook Live about that. I'd be happy to do that. I love educating people. I love talking with people. I love connecting with people. So I'd be happy to do that for, if people wanted to do that. Now, with medicinal marijuana, talking about getting, to the root cause of illness and, and relieving suffering. I mean, that is so important. Improving people's quality of life is so important. Cannabis is the single most powerful thing I have encountered in my over 30 years of being a doctor to improve people's quality of life, to improve chronic pain, which is the topic of the talk tonight, to relieving anxiety, relieving insomnia, getting people to sleep better, which helps with chronic pain, by the way, and anxiety, as well as helping with inflammatory and autoimmune conditions. Cannabis is such a powerful plant, can help with all those things. The majority of people who seek out medicinal marijuana seek it out for chronic pain. About 60% of people who use medicinal cannabis talk about, chronic pain is the reason that they do it.
Absolutely.
And there have been studies, and about 80% of people who use it for chronic pain say they get great relief from it. And that's, my experience with the patients that I've enrolled, bears that out. I've had people who had failed back surgery 20 years ago, and after using cannabis got relief and told me that they slept through the night for the first time in 20 years.
Wow.
Many other painful conditions like neuropathy, migraine headaches, they respond to cannabis. So, I feel that people should use this modality. We want to make sure that people are qualified for that if they choose to do that. And I'm happy to have discussions with people about that. We do free discovery calls in our practice if, anybody wants to just hear more about it. No obligations. But yeah, I am just so excited by this particular modality, again, because it relieves suffering and improves quality of life in so many people. So,
Yeah.
Again, please feel free to contact us, and be happy to chat more about that.
Well,
Thank you, Regina.
Thank you. Yeah, and working, being a medical marijuana patient, and just through personal testimony, it's really helped me deal with pelvic pain. I'm able to enjoy meals, and it helps keep my inflammation at bay. So thank you, Dr. Vinny, for sharing a little bit more about yourself. So I'm going to continue on here. So let's get into the meat and potatoes of the webinar. So cannabis is an integral component of the functional medicine toolbox. I definitely believe in plant magic. Cannabis is a plant, and it fits in perfectly as a tool for stress and pain management. Let's look at some stats here. According to the CDC in 2019, 20.4% of adults have chronic pain, and 7.4% of those adults that had chronic pain, frequently it limits their life or work activities. Chronic pain and high impact chronic pain both increase with age. So this is a serious issue. And just like Dr. Vinny said, most of our patients are enrolling into the program to treat chronic pain. So let's take a look at how, what specific qualifying conditions and symptoms of chronic pain cannabis can help with. So of course, nerve pain, that's a huge one. And we're going to talk about how THC has a special relationship with the central nervous system. Fibromyalgia, we know that this affects women. We have a lot of patients coming through the doors with horrible symptoms in fibromyalgia, whether that is the burning sensation, the fatigue, inflammation. We're seeing a lot of patients with this over the past couple years. And of course, cannabis can target symptoms from cancer. Nausea can help improve symptoms or side effects, excuse me, from chemotherapy. Arthritis, any type of inflammatory issue that you're dealing with. Bursitis, joint pain, visceral pain, organ pain. I am a patient for hormone imbalance issues, endometriosis, and IBS, which is a product of that. So if you are here and you do suffer hormone imbalance issues, pelvic pain, cannabis is life-changing. And then we have orofacial pain. There's a lot of patients that come through our doors with trigeminal neuralgia. That is a huge, painful disorder that I really do. My heart goes out to people. And then musculoskeletal spasticity, that's a qualifying condition, of course, migraines. So it seems like, cannabis is this miracle plant because it targets so many different disorders. It's safe and it's been used for countless centuries across many different countries and cultures. Now let's dive into the endocannabinoid system. So there's three important components of the endocannabinoid system. So this endogenous system is anything with a living thing with a vertebrae is going to possess this. It's comprised of three important parts. We've got the cannabinoid receptors. They're found on surface cells all throughout our organs, our skin, our tissues. And then we have the endocannabinoids. These are natural molecules that our body produce, and they're similar in structure to phytocannabinoids, which are produced in the plant. We find phytocannabinoids in the strains in our medical marijuana dispensaries like THC and CBD. And when we consume phytocannabinoids, we're engaging our endocannabinoid system. And then finally, the metabolic enzymes that break these endocannabinoids down, like FAAH, which is fatty acid amide hydrolase. This system plays a major role in our body. Actually going to use this first. And here's the 5 critical areas of our body that are regulated by our endocannabinoid system, which helps maintain our homeostasis, that natural balance that our body desires to have. So you'll notice the ECS will target the central nervous system, the brain, the GI system and intestinal tract, immune system, and peripheral system. We know that the ECS is going to play a major role in appetite, in pain, in memory, mood, fertility. But today we're going to focus on pain and dive deeper into that. You'll notice an endocannabinoid that has a very similar structure of THC is called anandamide. So some of us, as we have done our research, may be familiar with this chemical compound that we produce. Anandamide is the bliss molecule, and it helps regulate our dopamine and serotonin levels. So when we consume phytocannabinoids, there's specific ones that can actually boost our anandamide production by stopping some of these enzymes from breaking them down. And here are some of the phytocannabinoids that we'll find in our strains at RISE, like CBG, THC. The state of New Jersey actually tests for 4 cannabinoids: THC, CBD, CBG, and CBN, but we're discovering new cannabinoids every day. One of my personal favorites is THCV, helps suppress your appetite because with cannabis, it makes me enjoy food to the fullest extent. With that, you sometimes, it's nice to have a strain that can make you, not as hungry. So hopefully in the future, we'll start to see testing expand so we can see what, strains have THCV in there. And then we have our receptors, the CB1 and CB2, and the rest of these down here. But the prominent ones are the CB1 and CB2 receptor. We find CB1 receptor mainly in the brain and the spine, which that makes up our central nervous system. When we consume THC, one of the most abundant molecules in the cannabis plant, we're engaging this receptor the most. We're going to talk a little bit more about, hope everyone can see these. We're going to talk a little bit more specifically about these cannabinoids and what their therapeutic medicinal benefit is. It's amazing how we have this natural system in place. And I'm going to be sending everyone these slides as well. So no fret if I'm going a little fast here. And this goes back to the topic that I was referring to in the last slide. So we have endocannabinoids that we naturally produce, like this anandamide. And then we have cannabinoids that are found in plants, phytocannabinoids. They fit like a perfect key and lock. So this slide will depict that. And it's really interesting how these molecules have very similar atomic structures. And we're discovering new molecules every day, like delta 8 THC. As you do your research, you might see that pop up in your 2020 cannabis research. So here's an example of where these receptors are found all throughout the body, which really drives home why cannabis is so useful for so many different chronic illnesses. We're finding CB1 in the brain, spine, lungs, vascular system, muscles, GI tract. CB2, excuse me, is in the spleen, tonsils, bones, skin, our bone marrow, and our immune system, which is really important in this day and age. We all were under unprecedented times with the pandemic. And not to say that cannabis is a cure, but there's research out there now. In Ontario, for instance, they're growing specific cultivars of cannabis to target COVID-19 because it can help combat that inflammatory storm that happens, the cytokine storm, when we become infected. Cannabis can also target GI issues, which has been used medicinally for centuries. We know it's great for nausea, but for people that have Crohn's disease, for people that have IBS, there's pain that comes along with that too. Cramping, spasms, difficulty with bowel movements. So cannabis can definitely be a therapeutic. Excuse me, I have to let one person in. Welcome. It's definitely a therapeutic alternative. And I'm all about my research. So here's an example of how cannabis can help with Crohn's disease. We have a lot of research coming out of Israel, specifically Tel Aviv. And here's a specific clinical study that showed that cannabinoids, specifically CBG and THC, can help people with Crohn's patient and can help induce remission in these patients. And you'll find that with these studies, they're using minimal amounts of THC as well. All right. Cannabis and neuropathy. So, cannabis and neuropathy. So for patients that are entering PIH and are going to RISE Dispensary for their strains, a lot of them have issues with their central nervous system. So we discussed this a couple slides back. We have these CB1 receptors. They're spread all throughout the brain and the spine. And when we consume phytocannabinoids like THC, it's engaging this endocannabinoid system and help modulating inflammation. So when you think nerve pain, THC is definitely going to be your best friend. And I just want to highlight when we consume THC, this can actually help stop nerves from transmitting pain signals to the brain. A little bit about here, nice slide about cannabinoids. So cannabinoids are the fatty medicinal compounds that are found in our cannabis strains at ATCs like RISE Dispensary. The state of New Jersey will test four of them. We're going to see THC, CBD, CBG, and CBN. THC, you'll notice that there is a myriad of therapeutic and medicinal benefits that it can target. For me personally, it helps with my nausea, can help with inflammation in my gut, but we see it has very powerful properties. Anti-tumor, can improve mood, and can target nerve issues. CBD, I use that for inflammation. THC is for my neuropathy. CBD is highly anti-inflammatory, has some of the highest anti-inflammatory properties found in nature, and might have even longer medicinal benefits from THC. Not only does it target pain, but it's neuroprotective. There's clinical evidence that shows that CBD can actually rid our brain of that fatty plaque deposit that causes Alzheimer's disease. CBD can help regulate blood pressure. It can help as a bone stimulant. So for women that are suffering from, if you're going through perimenopause or menopause, we know that lack of estrogen affects our bone density. So CBD can definitely be great if you are someone that's worried about osteoporosis. And then we have CBG. This is another personal favorite cannabinoid of mine. For people that have spasms, musculoskeletal spasticity, CBG helps calm those down. It also targets ocular eye pressure. So if you are someone that is having a facial pain, migraines, if you're someone that has glaucoma, CBG is a very, very effective treatment. And CBG will also target tremors for anyone that has Parkinson's disease. It's known to help in that respect. And one last thing about CBG, I know I'm harping on this, it helps with your gastric motility, can help move food through your intestinal tract. CBN, not going to spend too much time on this. CBN occurs when THC is exposed to air, and it's nicknamed the sleepy molecule. So a lot of patients, they find if their strains have dried out a little bit, nothing wrong with that. It's just going to make your strains a little bit more sedative. So if you're if you like your uplifting, sativa energizing strain, you might want to make sure to keep the cap on tightly so that air is not exposed to it. But CBN is nicknamed that sleepy molecule, and you'll see these cannabinoids listed on your labels. I know that Vinny and Debbie will highlight this topic as well, but it's just wanted to touch base on this a little bit. But the terpenes. So not only do we have cannabinoids found in the plant, we have another therapeutic component, terpenes. They give the strains those strains color, aroma, scent, and they're going to fine tune the effects of cannabis. So if you're someone that's highly focused on inflammation, you have arthritis, strains that are high in pinene will be quite effective. Pinene is produced not just in cannabis, we're going to find this in the sticky sap found in pine trees, and any strain that sort of has like a pine smell, maybe smells like Christmas, we're going to have that pinene in there. Extremely anti-inflammatory, and also acts as a bronchodilator. It can help open up the airways and increase lung function. For those of us that are a little worried about what impact does inhalation have on my medication routine. For those of us that are looking to increase lung function, great terpene. I'm not going to go through all of these, but another one of my favorite one is myrcene. This is found in strains that are going to be fast acting. So myrcene lessens the blood-brain barrier. It's found in strains in the dispensary. It's also, like RISE, it's also found in mangoes, sweet basil, and hops. So if you're someone that needs to enhance the effects of your strain, or if you want to allow your strain to kick in faster, try drinking a cup of mango juice 40 minutes before you medicate. You'll notice that it'll help lessen the blood-brain barrier, allowing more THC in. It definitely is something that I use if I'm having a really painful week. All right. So we had some grand slams this year in cannabis research. We had 2 small sample gold standard studies published this year that help lend support to legitimize cannabis as a method to relieve pain. So first study we saw was the ingestion of THC-rich cannabis oil in people with fibromyalgia. So this was a small sample study that targeted women. We notice that women often will have fibromyalgia statistically more than men. And with this study, the women were only taking a small amount. So they were consuming an average of 4.4 milligrams of THC per day and reported that their pain was cut in half. So 4.4 is a very, very, very low therapeutic dose. And this is amazing that we can see that this improved their mood, their chronic pain. So for anyone that has fibromyalgia that's here, would be something to definitely consider. And this is another study that came out of Tel Aviv, and I will send people information after this session. Another grand slam that we had was a study that looked at a selective dose cannabis inhaler, just like looked like an asthma inhaler in patients with chronic pain. And again, it was 1 to 2 inhales that they found on this study that showed promise to improve chronic pain in patients with neuropathy, inflammation, and I can send information about this study as well. Here's a photo of the RISE Dispensary team. We have Debbie Trapanese and Vincent Mazzeo here with us tonight. And I am going to mute myself if Vinny could introduce himself. He's a patient care specialist. If you could tell us a little bit more about how you got involved in cannabis, how long you've been working for RISE, and what you do there. Sorry, guys. I know I'm clicking all over the place.
How's it going, everybody? Like Regina said, my name is Vinny. I've been in the industry actually for just about 5.5 years. I got my start out in Colorado. I've been with RISE right around 4.5 months now. My whole reason for moving out to Colorado, aside from wanting to be closer to the mountains, is getting in. I've always been passionate about. Sorry, I've always been passionate about holistic medicine, and I wanted to get my foot in the door in the industry. And so I went out there and I did it. It's definitely something I've seen a lot. I've met a lot of beautiful people, and I've seen a lot of people progress incredibly when it comes to cannabis. Cancer patients who were terminally ill have just like recovered within 6 to 7 months into remission. So it's unbelievable to see that type of stuff. And that's the kind of stuff that really kept me in the industry. And then I was diagnosed 2 years ago, and it helped me with my treatment. So I can definitely speak from it firsthand, not just as somebody who was previously a recreational user, but somebody who's now a patient for cancer and pains that come along with chemotherapy and things of that nature. But yeah, so I know that we talked a little bit about the testings of the cannabinoids and stuff like that. Oh, great. So here's a little Green Thumb Industries, Inc. It's a national cannabis consumer packaged goods company and retailer, promotes well-being through the power of cannabis while giving back to the communities in which it serves. I guess this is just pretty much our mission statement. Green Thumb Industries is a big company. They come from Illinois. And we have a lot of, GTI is a parent company to RISE Dispensaries. We also have Incredibles under our belt, which is a very predominant edible company that you'll see in recreational dispensaries across the nation. And you'll soon see it in New Jersey as soon as Jersey loosens up on these regulations. You'll start to see companies like Incredible, Mary's Medicinals, I believe, is now under our umbrella. Dog Walkers is one of ours. Rhythm is our premier brand, and then Shine is like our D-list bud brand. But we got a lot of good stuff coming as soon as Jersey lets us do what we got to do. But
yeah, and then Vinny, if I'm on a slide for too long, just let me know. Ready to go?
Yeah, you can keep it moving. Yeah, it's okay. Okay, so there's three main plants. There's the cannabis sativa, which is going to be that uplifting, energetic high. That cannabis indica, which is going to be known to be a little bit lethargic, good for body relief and anxiety. And the ruderalis, aka, I mean, the list goes on with what you can, all the fun names you can call it. Every day there's a new name being made for cannabis in the culture. It's been used in medicine since ancient times, along with a myriad of other adaptogens and ethogens. The U.S. started prohibiting marijuana back in the 20s, and it's a fun little research tidbit if you want to look into it. It all comes from lobbyists in the paper industry, which is a whirlwind. And with widespread public health education, cannabis will be a cornerstone of healthcare, just like it's been for thousands and thousands of years. So,
absolutely. I know, it's crazy. We used to be able to use hemp to pay our taxes in the beginning of the 19th century.
So. I mean, yeah. Thomas Jefferson writes in his journal how his best ideas came from smoking his hemp pipe on his front porch. So, yeah,
absolutely.
Founding father, one of the many who smoked cannabis. Is cannabis safe? This is a question we get asked a lot from our more elderly patients, our people that tend to be a little bit more naive or reluctant to use cannabis. They seem to think because of the way they were taught in the educational system that it is so harmful and that it's the gateway drug. But it is not a gateway drug, and it is far from harmful. As you can see in the statistics show that there's far more deaths from tobacco, poor diet and exercise, alcohol, and opiates alike. Cannabis no one's ever died from a cannabis overdose, ever. I'm not going to say that people haven't died while they were on cannabis, but that's a totally different thing. But no one has died because of cannabis. Yeah,
you can discontinue use at any time, and you're not going to be burdened with all of these host of side effects of other pharmaceutical medications.
It's less addictive than coffee.
Beautiful.
And sugar. Yeah. If you find yourself needing a bagel and a cup of coffee in the morning, that's more harmful than smoking cannabis.
Absolutely. And for those of us that are unfamiliar, using cannabis to exit opioids is a qualifying condition in New Jersey.
Oh, yes. All right, so the phytocannabinoids. So THCA is the non-intoxicating form that THC starts at, but actually it all starts as CBG. So everything when you're growing the plant, the only cannabinoid that if you were going to test it right from its birth is going to be CBG. And then over time and nurturing and care and all the right nutrients, it all turns into everything else. And the first thing you need to get THC is THCA. And through decarboxylation, so backtracking a little bit to what you were saying before, Regina, about how we test for THC. We don't actually test for THC, right? We're testing for THCA because THC is not present in the plant itself unless it's decarboxylized. So now when you go and you start testing extracts and testing what's prominent in edibles and what you're going to be using in edibles, then you'll start seeing THC. But we don't get that unless we decarboxylate. And when it becomes psychoactive, it has the anti-cancer properties that we were talking about. It's an appetite stimulant. It subsides nausea. It's good for an antidepressant. It relieves pain. I mean, the list goes on and on to the benefits of THC. And there are also some great benefits to THCA as well, especially when applied topically. It is a great anti-inflammatory. You'll start seeing that as the topicals in New Jersey start to get a little bit more predominant, and you're going to start seeing things with THCA because it is a better anti-inflammatory when applied topically than THC. THC is the king for when it comes to like consumption and smoking, but THC,
yeah, I appreciate you clarifying the difference between the acidic precursors.
Yeah.
And so thank you for clarifying that.
Yeah, of course. Everything starts with an acidic precursor. That should be known too. Like CBD as well. You don't see raw CBD in a plant when you test it, but when you decarboxylate it and you get the extract, then you'll see the raw CBD. And we lose, actually, I don't know if there's a slide on decarboxylation ahead, but you lose about 13% of that testing percentage. So let's say, for argument's sake, that a plant tests that THCA level of like 20%. If you multiply that by 0.87, I think it's around 17.4% THC would be what you're inhaling, if that's the truth of the test. There is a testing variancy when it comes to plants. I don't know if we're going to touch upon that later, so I'll just say it now. But when it comes to testing variancies, a lot of people like to know what's your most potent strain, what's your highest strain. And it's really hard to say because they only test a very, very little bit for a huge amount of plants. You're skipping through to it. Yeah, here we go. The testing variance is perfect. Yep, so 17.4%. So it is really hard to say when you, especially when you're smoking cannabis, that like, yeah, this is the amount of THC you're gonna get, because I just don't know. Because like I said, they're only testing a little bit, and it goes over hundreds of plants depending on the size of the grow, and then everything gets bottled up and packaged, and this is the way New Jersey does it, and we see it. Now, when it comes to something like an extract, it's a little bit more precise because now we know exactly for sure what's the batch is smaller one, and we're seeing a concentrated amount. So it's the same as going and buying like an ashwagandha extract, like an ashwagandha tincture from Whole Foods. You know exactly what's in there because it's an extracted source and it's very precise on the dosing and everything like that. But with the plants, it's Mother Nature, and it's chaotic, and it's beautiful, and it just is what it is. But the terpenes are the most important thing when it comes to ailing pain or anything else, because those are going to give it the specificity that's going to make it what it is. But yeah.
Let me ask you this. So at RISE, if patients have questions about testing and work with it, so they'll have support from a care specialist like yourself.
Yes. Mm-hmm. Yeah, so I'm on the front line, so to say. When people come in, I'm usually one of the people that they see, and I try to keep it as transparent as possible. I'm only concerned about the patient in front of me. I don't care how long the line is. I don't care about anything. We're here to help you, and we're here to help the patients, and I will give as much information as they need. And I have this conversation about varying fees because people just don't know. I mean, because a lot of doctors who are ill-informed are sending patients in and saying, get the strain with the most THC. So that's telling me that the doctors don't even really know, because they should be educating themselves on what they're sending their patients in. So I always tell people, like, if you're concerned about the amount of THC that you're getting, go with the consumable, because you know for sure what you're getting. Something like a tincture is ideal because it's homogeneous in the sense that every dose is going to be exactly the same. But when it comes to something like a lozenge, especially because it's coated, because it's a sublingual form of ingestion, it's not going to be homogeneous. So if I cut the lozenge in half, it's not going to be 5 and 5. It could be 10 and 1, 9 and 1. It could be 8 and 2 if there's 10 milligrams in there. You just don't know. But the tincture is the best route for a surefire. This is the amount of THC you're going to get. It's going to hit you in 20 minutes, and you're going to be relieved.
Perfect. And for those of us that are unfamiliar with a tincture, we're going to get into that in just a second.
Actually, the benefit of me sitting in my room right now, I have visual aids if people would like to see it firsthand.
Yeah, please. No, I love show and tell. Yeah. That would be great.
Yeah.
And I know I'm backtracking a little bit, but I know Debbie provided you with the slide, and I just thought this was such a great slide to show that the structure is so similar between substances that we naturally create, like anandamide and THC.
Oh, yeah. I mean, we see this across the board when it comes to ethogens and things that nature provides for us that the government is suppressing for years. I'm sure Dr. Leonti has seen this with serotonin and psilocybin and LSD. It's right there in the research that Johns Hopkins has been putting out over the past 50 years with those substances in terms of depression and end-of-life traumas and terminal illness. It's unbelievable. And over the past 5 years specifically, I mean, the government has really gotten the ball rolling again on this stuff. So when, like, just talking about the molecules and their relation to what we're seeing in nature, it's unbelievable when it's just like a plug and play method when you consume these products or these plants, and it's just literally just all you need to do is consume it. And it opens up a world of abundance and good health.
Absolutely. I apologize. I'm clicking around so much, everyone. I hope this
No, it's okay. I'm rambling a little bit. I start to go on rants when I'm talking.
No worries. Okay, so I'm going to go back to, all right, so I know we talked a little bit about this, but next topic I want to cover is dosage, because just like we were talking about, cannabis is such an individualized therapy. It's really hard, even for Dr. Leonti to, write a prescription and say, this is 3 milligrams for you, this is what you'll take, because there's that trial and error period. But I know there's some logic behind this, and you help patients all the time find their right dosage. So could you talk a little bit about, what the approved forms are?
Yeah, sure. So right now in New Jersey, we have flower. So we're going to see that in forms of loose buds that you can grind up and smoke, and something like a bowl, which is something that I prefer. I prefer glass. The less paper I'm inhaling, the better. But we do offer pre-rolls, We don't always have shakes, so I always recommend pre-rolls to people that are elderly or don't really want to be fussed with the grinder, because you can open up the pre-roll and use that as you wish. We also have the extracts. So we have the extract is meant for topical use. I know that for a while people have been saying you can use it orally. It's not meant for that. Although it is not harmful, it is near impossible to dose. And anybody that has taken too much THC orally can tell you that it is not a good time mentally. You don't want to go down that rabbit hole. We're looking to help you. We're not looking to hurt you.
Absolutely.
So sorry?
I said absolutely. Yeah.
Yeah. So we're going to stick with the extracts for topical use. And I always recommend, I know you said somebody in the chat, I think his name was, began with a P. He has a CBD, he worked for a CBD company, hemp-based CBD company. And that's awesome that he's here because he can attest to this. When it comes to the topicals especially and the tinctures, which we'll get into, I advocate for people to use them with a hemp-based CBD product because it's going to work synergistically. The compounds do not know once they meet that they're from different plants, that they're from different sources. And when THC and CBD are fused together, it's like, think about it like when you eat something like rice and beans. Yeah, you can eat them alone, but when you eat them together, the branched chain amino acids come together and form a full strain of protein. And that's exactly what CBD and THC do together in that sense. Is they come together and they work more powerfully to alleviate any symptoms that they're going to target. So when it comes to the topical, I tell them, hey, throw it into a whole bottle of CBD lotion, mix it around and mix it for every use. Moving on, the vape oils, that's something that kind of looks like this. It comes in a little cartridge, and this is a rhythm cartridge. It's super easy to use. You just kind of screw it on and you smoke it. And this is where you're going to see the stuff that's testing as THC, not THCA or CBDA. The acid's going to be dropped off because it already is decarboxylized. This is very good and discreet. We call it like the mom dose because mom's on the run with their kids. They want to be discreet. They want to do it. They take a hit and they're on the move. Lozenges. These are going to be the only edible that, but aside the tinctures really are inedible too. They're both consumables. Let's call them that. But the lozenges are going to be the only edible form that New Jersey kind of lets us push out right now. And they are going to be, I believe, lozenges typically are coated because you're supposed to ingest it sublingually, which means it dissolves in your mouth. So these aren't going to be infused, as best to my knowledge. And it's something that you just suck on, you finish it in your mouth, and within 35 to 50 minutes is when most people say that they feel an effect, and they come in a 10 milligram dosage. They're going to say that's a single serving, but you have to be the judge of that yourself, which is why I would recommend something starting out with the tincture, because the tinctures is way easier to dose in what we call a micro dose form. So the tinctures, I believe I got some actually from Incredibles from my stint in Colorado. I brought some back with me. So the tinctures come in a little bottle like this, and you just squeeze it out in the pipette, and it just comes in a little serving like that. And each serving of the ones that we sell from Curaleaf are going to be 5 milligrams, 5.5, I believe, of THC and 0.5 of CBD. So that is a 10-to-1 ratio. And again, I recommend people take this in conjunction with CBD, hemp-based CBD products, because it will amplify the effects, and it actually dumbs down the psychoactive effect. So someone dealing with for daytime pain and they need a high dose of THC via tincture, if you cut that with the CBD, it will dumb down the psychoactive effect and make you more able to go about your day. And another cool thing to play with the tinctures, if you do need, if tincture is your consumable of choice, and you do need something like a sativa that has more energy, because what they're doing in the extraction process is they're not pulling out the terpenes, so you're left with just a hybrid, non-strain specific hybrid extract. And what you can do is you can add it to something, because terpenes are found in abundance in nature, and something like orange juice is going to have a very similar terpene profile to many sativas. And if you add the tincture to an orange juice, it will actually give you and act like a sativa and give you that uplifting, energetic effect.
I love that. I do.
What's that?
It's my morning ritual. I love add either lemon water or orange juice.
Yeah, any citrus. Yeah,
feels like
it's unbelievable. Yeah, it's unbelievable. I like to do it with lavender tea. I tend to be a little already a naturally stimulated person, so I use it with like Lilinol, or I use aromatherapy, but I like to use patchouli a lot and tea tree oil, and that kind of helps me with the tinctures to calm myself down. But yeah,
I wanted to go back to sorry about this. So We talked about the approved forms, the vape oils. So I'm a patient myself, and I know right now there are 3 other dispensaries that create different cartridges, and these are so interesting to me because I haven't tried them. I haven't heard of them. These are pretty new. Can you tell us a little bit more about these cartridges and tell us about this company?
Absolutely.
Yeah.
So when I first came to New Jersey, I was very disappointed with the way the culture was going. I like cartridges when I'm on the go, and cartridges was like my main stem of disappointment. And my only exposure to them was Curaleaf at the time. And what Curaleaf does is they are not extracting the terpenes. So what they're left with is a non-strain specific extract. And I just want to backtrack a little bit and give a little bit of foundation to how kind of backwards New Jersey is right now with its regulations. So New Jersey likes to say everything is 70% THC when it comes to cartridges, right?
Mhm.
But that would mean that only in the state of New Jersey we know how to extract an exact amount of THC from a plant, which is impossible. If you know anything about extracting even essential oils, anything, extracting anything, you know that that's impossible to get an exact amount of anything. So their kind of workaround is, and unfortunately we don't know exactly what is present in each cartridge from each extract, is they're putting 350 physical milligrams in a 500 milligram cartridge. So now when you extract something, you're using a solvent. What Rhythm does is we use CO2. Curaleaf uses CO2. Almost everyone uses CO2 right now. It's the cleanest solvent, but you're left with some of that in there. So what Curaleaf does is they put 150 milligrams more of the solvent in there. So it's not harmful, but they need to have 500 physical milligrams, and 70% of those physical milligrams need to be THC extract. Whether or not it's 70% THC, we don't know. As long as 70% physically of the THC extract is there. Is that making sense? You understand what I'm saying?
Yeah, I'm following you.
Yeah. Okay, cool. So now what Rhythm does is like, all right, instead of pumping the cartridge with 150 milligrams of more solvent, which is useless and you're just smoking nothing, let's extract the terpenes and put that in there. So now what you're getting is a full spectrum, entirely strain specific extract, which is exactly what you want when it comes to an extract. Not to say that they are stronger, but they are by far more effective than any other cartridge in the state of New Jersey. And I can say this firsthand. I've tried them all. You're going to get that strain specificness. You're going to be able to say, this is going to be good for my anxiety. This is going to be pain relieving because we're getting those terpenes. And like I said, they are just far, far superior. It smells and tastes like cannabis as opposed to that oily kind of like burnt taste that you used to get from the Curaleaf or other brands that do it wrongly. Like Kingpen is one of the ones that I see on the street all the time, and I try and talk people out of all those black market cartridges on a daily basis. But
I totally hear you. And I'm
yeah.
looking at the so what do you think would be the best one for chronic pain? I noticed they have, a heel, they have a heel blend.
So right now, I love the heel, and I actually make the pilgrimage out to Rise and Amherst to get the heel one because that's going to be the predominant CBD. That they do like a 1-to-1 and a 2-to-1 out there. And I love it. And for some reason, New Jersey is just against that right now, which blows my mind.
Mm-hmm.
But like I said, I go out to Amherst for that. So the heel would definitely be the best for the chronic pain because it's majority 2-to-1 or 1-to-1. The heel is the CBD to THC run. But when it comes to the terpenes now that we're talking about that are present, we can decipher what someone is coming in for and lead them towards the terpene profile that we believe is going to help them the best. And Rhythm cartridges are great for that. Like I said, because the terpenes are present. It's just like the flower. So depending on the strain, it's really strain dependent, and the strains come and go. It's just the nature of the beast. So I always tell people, if you like something, buy a lot of it because you don't know if it's going to come back.
Yeah. And I also wanted to highlight there, sorry, I didn't mean to cut you off there, for patients that are totally new, because you're such a wealth of knowledge for this, for patients that would say, why would I go with the cartridges over flower? I mean, it's pure preference. Wouldn't you say that they're more discreet? They're not as, producing an odor like you would if you were to smoke a joint or...
Yeah, absolutely. So flower tends to latch onto surfaces, tends to latch onto fabric. You can smell it. It's like where that kind of like contact high came into, like that phrase came. It's like someone walked in after they smoked a joint and you can smell it on them. And it's like, oh, you caught a buzz. We can smell it. The cartridge does not linger like that, but it's personal preference. I mean, the cartridges are going to hit a little bit harder. So for someone who's inexperienced, I would say take small hits, but definitely go for the cartridges because it's going to be more of a precise effect. I prefer the flower. Like I said, I like, so like if I start my day and I'm in a lot of pain or I'm anxious, I go right for flower because it's instant relief. And I just think my preference and my knowledge brought me to that flower is king. But throughout the day, I find that once I've smoked my flower at the beginning of the day, if I use my cartridge intermittently throughout the day, it just brings me to that point of relief again. So that's what I think the cartridge is great for. It's not going to get me where I need to be. This is, like I said, it's all personal, and everybody's going to find what works for them the best. We actually have new patient logs that we give out for free. So when you come to RISE and you say, hey, can I get one of those new patient logs? Journal everything, how things affect you, time log it. Smoked at 10 o'clock, 10:30, I'm feeling great. 10:45, you don't write anything. You wake up the next morning, I fell asleep before 11 o'clock. Like write this stuff down and log everything that you do. But it's all going to be personal preference. I prefer flower over cartridge, but like I said, I use them where I see fit in my life with my experience. And everyone's going to have a different method to their madness.
Gotcha. Sorry, I'm clicking around here. I wanted to go because there's a couple slides that I was interested in you touching base on, and for everyone else that's here. So I know we talked about the vape oils, we talked about the different approved forms, the testing variants. In terms of oral consumption based on, the tincture, the lozenges, dosage can be tricky. And I thought that this was a great recommendation. So I like how RISE splits it up into patients that are comfortable with ingesting THC, and then patients that have no experience at all. Could you talk a little bit about dose titration for people that are experienced and not experienced? How would you answer a question if a patient came in and said, what's my dosage? How do I...
So I would refer them, I would just say, this is something that you're going to have to figure out, but I would give them recommended guidelines, and I would ask them vetting questions to know kind of where to take the conversation, where to take what I would recommend for them. So have you consumed cannabis before orally? And that's like the first question I ask. And if they say no, then I immediately say, we're going to do a tincture, and this is how you're going to do it. So for somebody, let's just use that as an example. Somebody who's never consumed, here's the tincture. We know that each full 1 milliliter serving is going to be a 10-to-1, 5.5 to 0.5, right? So now I would recommend them cutting that in half, taking half of the milliliter, giving that about 30 to 40 minutes. And I would always, like I said earlier, I always recommend them taking it in conjunction with the hemp-based CBD tincture, because it's going to cut down that psychoactive effect. Anybody that is familiar with consuming cannabis, now I just tell them to do this because I want them to realize that I am not BSing them when I say that 2.5 didn't do anything for them. People need to experience it for themselves. So I can preach and say, listen, this isn't going to do anything for you, but they need to up the dose themselves, because that's where the comfort's going to sit in when they're doing it themselves and they're seeing it go in and all that. So I would say start with 2.5, give that an hour and a half. And if you feel like you want to consume more, take the same dose again. Do not double up right away. Take the same 2.5 an hour and a half later. And do this intermittently throughout your day. And then the next day, remember, go back to your log and say, okay, that 2.5 wasn't enough. Let me start with that 5 milligrams today. And then you start with that 5 milligrams. And then an hour and a half later, hey, I could take a little more. Do a 2.5. So we're going to level up in those 2.5 increments. But something like the tincture, because it's homogeneous and it's super easy to dose out, that's the best way to do it. With the lozenges, like I was saying, because they're not homogeneous, and it's not for sure to say, all right, I'm cutting this in half, this is 5, and I'm cutting that in half, and that's 2.5. Until we get homogeneous gummies or chocolate bars, things of that nature, it's really hard to say. So the tincture is the best bet for somebody who's new to it. Now, for somebody who's experienced coming in and saying, hey, I don't have a tolerance, I have a high tolerance. I hate that word tolerance when it comes to cannabis, because that kind of insinuates that you have a physical dependency on it, which we know that's not the case. So I had somebody come in just a couple months ago, and they said that they've tried edibles and they can't smoke because they have ailments with their throat and their lungs, not to get too specific, but they can't smoke, and they've been trying edibles and nothing's working for them. So because I'm so passionate about holistic medicine, and I kind of know the body, I was a personal trainer and nutritionist for 7.5 years. And I kind of got to know what's what in the body. And I recommended them. I said, you're going to think I'm a kook, but start drinking kombucha every day and stop eating meat and gluten and sugar for a month. I said, give it 30 days and then come back. I said, come back to consuming cannabis. And they did this, and he came back a month later. He's like, man, I was eating a whole package of lozenges a day, which is 350 milligrams in a day, not feeling anything. Now he consumes 25 milligrams and he's zonked, he said. He said it does everything he needs to do. So we, that's like less than a tenth just from cleaning his gut for 30 days. And now he's like, my wife thinks I'm crazy because I drink kombucha every day and I stopped eating bread and I don't eat red meat anymore. And I'm like, well, these are the things that was gunking up your system after years and years and years of putting all these processed foods into your gut. And because people think that if they eat, sorry, I'm going on a rant here, but people think that if they consume, broccoli for a week, that they're doing themselves a favor. But the fact of the matter is your body's getting nothing from that broccoli for that week if you're still eating everything else, especially after all the years of abuse your gut took. It takes at least 21 days for your body to acclimate in your GI tract to recognize them.
We're definitely aligning here because what you're saying is right in Dr. Vinny's wheelhouse at Princeton Integrative Health, because a lot of patients don't realize that, why aren't edibles working for me? If you have problems in your gut and you're not digesting nutrients from food, you're not, same thing with the cannabinoids. So a lot of people have leaky gut that they don't realize. We offer a test. It's called a GI map that you take home to assess the inflammation levels in your gut and to see, if you have any pathogens or worms or issues. So I love that you're bringing up gut health because it's huge when it comes to making sure that your ingestibles are working effectively.
Also that your brain is working effectively, right? Our gut is directly connected to our brain, and a lot of people don't realize that. That's like our source of everything, happiness and fatigue. It's everything. It's all in our gut.
Yeah. I just wanted to see, Dr. Vinny. All right. Oops. Okay. So we talked about, thank you for that clarification with dosage, and just for, patients that are new to the program, or maybe someone that hasn't been to RISE Dispensary and you've gone to another dispensary and it's been a little crazy and you haven't been able to have, get support, consultants like Vinny here, or can I call you Vinny or Vincent?
Vinny, please. Yeah.
Can answer all of these questions and be that support for you.
Yeah, and we always do consultations, whether you're a new patient or not. If you want to come in and have a sit down with me or any other patient care specialist that should have the knowledge that I have, just call and make an appointment. You can even ask for me directly when you come into the store. If you didn't make an appointment, just be like, hey, I'd like to see Vinny, and they'll have you wait until I'm available, and I'll come see you, and we can go to the consultation room and you can ask questions all day if you want.
Oh, that's great to know, and glad that you're that support for them. So I know that a lot of patients from our area, they call in and they ask questions about the strains. So I know you guys have unique strains, a lot of them that I haven't tried yet, but could you talk a little bit about your genetic strain library? I pulled some of these from the website. You have
so these, so this candy store and the sour apples are two from actually Paterson. So Apothecarium is a dispensary out in Phillipsburg, and they are the ones that actually grow and cultivate Sunshine OG and sour apples and candy store. So when it comes to what's from our cultivation, that's going to be anything under Enshine and the yet to come Rhythm brand. I have been out of work. Unfortunately, I did catch the COVID bug, and I've been out of work for a couple of weeks. So I don't know what's on the menu now. Just because, like I said earlier, the strains kind of come and go. So it's really hard to keep up, especially as the culture progresses and more people start to grow and we start to get more pheno hunting going on. And pheno hunting is when a grower is like, when you see Gorilla Glue number 4, that's the 4th phenotype of Gorilla Glue that became so popular decades ago. So you're going to start to see more and more of that. But generally, what's available is kind of like a crapshoot. We like to, indicas tend to go the quickest, and I think that is because we're in the state of New Jersey and everyone's anxious and stressed out and has trouble sleeping in this area, so they all want the indicas. So whenever we get an indica, that kind of goes. We generally have a lot of sativas and a lot of hybrids, and every hybrid is going to lean one way or the other. And I know I specifically like to indicate on the menu in front of me which way the hybrids lean. I also like to familiarize myself with the terpene profiles of every strain that we carry so that I can help somebody discern what's going to be the best for them. But something like the Sunshine OG, since you have these up in front of me right now, I can talk a little bit about this from Paterson. They're a great grow. I really stand behind what they produce. Their flower is excellent. It's very healthy flour. I like that they give everything in glass jars instead of plastic. I'm a little bit of like an anti-plastic lunatic, but I really like the glass jars instead.
Yeah, great
It's
packaging.
not, sorry?
It's a great packaging.
Oh yeah, they're beautiful. They're aesthetically pleasing, and what's great about the mason jars is that people hold on to them and they keep their bud in them forever. And I recommend, like, I keep my bud. I recycle my little peanut butter jars, and I keep my flour in there. And when it starts, if I'm not using it fast enough, I actually go and I buy the Vita packs for cigars, and I put that in there to keep it moist and fresh. So the glass. Sorry.
I was going to say, let me ask you this, just for, you know, our patients on here that are looking, you know, maybe they're new and they haven't become patients, or maybe they're current patients and they're just looking for a new dispensary. What would you say is a popular strain for severe pain? I know each strain is different effects, but what would you say patients come back and they said that really, really helped for my severe pain?
So the one that we've had the most good feedback for chronic pain is going to be from Enshine, and that's going to be the bananas and cream. And that is a very, very deep indica, very fruity in taste. Terpenes are excellent. It gives it like a very fruity, grapey feel to it.
Mm-hmm.
It almost tastes, when you smoke it out of something like a PAX 3, like a flower vaporizer, it's a full smack in your face, like creamy, fruity goodness. And it's very sedative, nighttime use, unless you're an experienced user who can take an indica like that on during the day. But I recommend, again, I always recommend with anybody, especially something with a deep indica like that for chronic pain, using it in conjunction with its parallel hemp-based CBD product. And you can buy hemp-based CBD flower from the state of Oregon online, $250 a pound, which is an outrageous amount for a very low price. And I kind of roll that in my flower like spliffs. Another really, really good strain that we have for pain that I can't wait until we get it. It's our Cannabis Cup winner from GTI Grows, and it's in every other state right now except for New Jersey. But it's called Brownie Scout. So keep a lookout for that. It is unbelievable.
Brownie Scouts.
Brownie Scout. If you get a chance to go to Amherst, Massachusetts, to our recreational dispensary out there. First of all, Amherst is a beautiful, beautiful little quaint eccentric town full of a bunch of old hippies and deadheads. Good food, good energy, good vibes. It's right in the middle of UMass and Amherst College campus. It's awesome. But they have a crazy selection of what Rhythm really has to offer. And their Brownie Scout is there. And it is one of the, and 5.5 years in the industry, is one of the best flowers I've ever tried.
So I know I don't want to keep everyone too long. We're at 7:43. We just have a few more slides left. And I just wanted to also introduce Debbie, so I could just hear a few words from her as well. But you have the lozenges, which you talked about. You carried those from Curaleaf as well as the tincture. Mm-hmm. What would you find that this is effective for? And is there a flavor with this, or could you tell us?
Yeah, so they come in 3 flavors. Watermelon, passion fruit, and lemon are going to be the 3 flavors that Curaleaf puts out for the lozenges. The benefit to this is someone who's experienced, who knows their dose, who knows they can throw 2 lozenges in their mouth and be on the go and be fine. That's what I recommend it for. Someone who just is confident with their cannabis use, someone who's been doing it, who knows what's up, and they know that they can throw down the house. Because like I said a few times already, they're not homogenous. The other thing you need to keep in mind is, because I know they say infused, but that kind of, I really need to find out. I haven't been able to get a straight answer from Curaleaf about if they're infused or coated. Every candy that's a lozenger that you suck on that I've come across in the industry is coated, because it's meant for sublingual use, which means if you ate it, your stomach acid would eat most of the cannabinoids that are present around it and would have not even a tenth of the effect that it should. Mm-hmm. So like I said, these are for people that can, and they don't taste that great. Even though they're flavored, they taste, it feels like you're kind of sucking on a piece of chalk. And so it's really for like the connoisseur who knows themselves and they're dosing well enough to deal with the taste and suck on it and go about their day and feel good. Gotcha. Definitely recommend the tincture for everybody else.
Okay. And for those of us that maybe don't like you taking things sublingually, is it an option to mix the tincture in with your food? And if you do that, is it going to take effect right away? Or with sublingual onset effects can take anywhere from 20 to 30 minutes. But if you were to mix the tincture directly with your food, is that something that patients can do?
Yeah, so I wouldn't recommend putting it on like a sandwich or anything, but it will dissolve pretty easily into bread or, you know, into a bowl of soup or whatever. It's not gonna, it's unflavored, but it will give it like kind of like an oily, because it's coconut oil, and it will give it, you know, that kind of like oily feel. It's not going to diminish the effects all that much. It will make the onset a little bit longer. Instead of that 15, 20-minute window, you're probably looking at closer to 45, just because it has to go through more of a process in your body when you eat it, as opposed to letting it sit under your tongue for 10 seconds and swallowing it. But instead of eating it, I definitely recommend, if you don't want to let it sit in your mouth, you're opposed to that for whatever reason you have, doesn't matter, drink it. Drinking it is going to be a lot quicker and a lot better than eating it.
Gotcha. And I know we talked about the vapes, but you also have cannabis CO2 extracts that come in the syringe, and that was the product that you said is not meant to be used it's not an ingestible, but it's better as a topical, correct?
Yeah, so it's not. They've been saying it before I started working there, and even still, some people recommend patients eat it. I don't recommend it, just because it's not harmful to eat, because it is coconut oil based extract. Doesn't mean that it's good to eat, because the way it comes, the way it's packaged, and the way you have to dose it out for yourself is near impossible. And I hear at least one horror story a day when people are like, I came in and they told me to eat this and I was so high, I thought I was going to die. I thought I was going to have a heart attack. And it's like, I was so uncomfortable for hours and hours and hours on end. And it's because the reality is it's hard to dose. But yeah, that's how it looks. And they want you to take 2 little lines, not even like a full CC measurement. 2 little lines is what they were telling people to eat to get a proper dose. But it's impossible to do. Unless you're like a surgeon, you're not going to do that.
Yeah.
So it's purely meant for topical. It says it right on the label, meant for topical use. You can add it to a vino lotion. I recommend, like I said earlier, adding it to a hemp-based CBD topical, because it will be more synergistic when used in conjunction with that. You just add a little bit. A little bit goes a long way, especially when you use the CBD cream. You're just gonna add it to the bottle and just rub a little bit on. It's best for like the kind of thin skin spots, so like wrists, ankles, neck, elbows, shoulders, where there's like a little bit of a thin skin. But when you're talking about your back, that's where something like the tincture and the topical is something I would say is the path you should look into.
Absolutely. And for those that are thinking a lotion, what is that going to do for me? You have receptors all over your skin, and you can get relief for up to 1 to 4 hours with the topical, especially like you said, if you have a localized issue.
Yeah, and the thing that people always ask and they're concerned about when it comes to the topicals is the topical is not psychoactive. Even though it's not THC, it's THC, the psychoactive component. It's not going to get you high unless it's transdermal. Now, transdermal patches are a thing that we'll probably see in the future in New Jersey. I know Mary's Medicinal makes them. They were some of my favorite products. One of my favorite companies. I'm so happy GTI is the parent company to that now, because that means we're going to start carrying it. Mary's Medicinal, I cannot speak highly enough about that company. They are unbelievable. But unless the topical is transdermal, it is not going to be psychoactive. This is not. It's near impossible to get high unless you consume it, which I don't recommend doing, obviously. And something, another tidbit of advice I always give people when it comes to the topical is try and do it after a hot bath or a hot shower. Dry yourself off, because your pores are open. They're more receptive to what you're putting on it topically, right? Mm-hmm. So that would be the best way to do it. And the dosing, for lack of a better word, when it comes to topical, you're going to find what works for you. I usually recommend people do it once in the morning, once in the afternoon, and once at night. But you should use it as often as you need to. And a little bit goes a long way, but you're going to kind of figure out what a little bit is for you. So,
gotcha. Thank you for sharing all of this amazing information with us. You're a wealth of knowledge, and I can't wait to come visit you when I go to RISE to check out some of these awesome strains and products. And I just wanted to check if Debbie is still on. I just wanted to introduce the community outreach manager, and if she could just give us a few words on, what makes RISE unique. I know you have some awesome discounts. So is Debbie there? Let me unmute her. Oops. So, sorry about that, Debbie.
That's okay. I'm here. That was great information from you, Dr. Leonti, and our Vinny. And as you can see, the RISE experience, that's what you'll get. You'll get very knowledgeable patient care specialists and very compassionate ones like Vinny. So a little bit about RISE. We're located in Paterson. Some exciting news. We are opening up a new store in Paramus soon. We don't have this start date yet, but hopefully soon. And with a lot of the dispensaries now, they're having patients make appointments. So with RISE, there's no appointment necessary. We take new patients and walk-ins all the time. Patients can call and request a consult, so we will offer that in-depth one-on-one patient consultation. Patients can order online and pick up the same day, which is super easy and convenient. We strictly enforce all COVID-19 safety regulations. Very safe and convenient location, located right off of Route 20 in Paterson, and we have security and plenty of parking. Education and supports for patients. We're doing a series of educational videos, virtual webinars, really trying to get out in the community and talk about how cannabis can help our patients. High quality medicinal cannabis, and we have some great patient discounts. A 10% first time patient discount. If people are over 65 on government assistance or disability, they'll get a 10% discount every time they come. Veterans, I mean, we absolutely adore our veterans. We give them a 20 to 40% discount depending on their disability rating. Mm-hmm. We also have the High Risers loyalty program. So every time a patient spends $1, they'll get a point, and then they can redeem it towards future purchases.
That's amazing. 40%, that is the highest discount I've seen out of any dispensary in the state. That's amazing that you guys do that for our veterans. And if you don't mind, could you share a little bit about yourself and how you got into the cannabis industry and working for RISE?
I didn't find cannabis, cannabis found me. And I'm so grateful because this is probably the most rewarding career I've ever had in my life. I came from the pharmaceutical industry. So I was a pharmaceutical sales rep for 20 years. And just being in cannabis makes me realize how, I mean, every pharma has its place, but how this beautiful, wonderful plant can help so many patients. I mean, I never had a patient come up to me and be like, Debbie, oh my God, this cholesterol drug makes me feel amazing and I have no pain and this and that. Yeah. No. But I'll get the 70-year-old woman like screaming for joy, you know, she's like, I got like metal plates and rods and I fell and I have so much pain and I use this. And it's just a miracle for me. I've cut back on all these medications that I've taken. I don't get side effects. And that's another great thing about cannabis. I mean, all these conditions overlap. So you can have anxiety, you can have chronic pain, and the cannabis will help both of your conditions or any of the conditions that you overlap, because there's a lot of them that do.
Perfect. Thank you so much.
You're welcome.
For sharing the information. And we're going to be sending out to all the participants and for people that weren't able to make it tonight, we're going to send out information about how to enroll in the program, how to get to RISE, and what the protocol is to purchase there. So for those of us that are not patients yet, we'll send that information to you.
Oh, can I just add one thing about the medical program? It's really important for patients to renew their cards or get their medical marijuana card and don't wait. There's so much misconception right now about recreational use. It's not going to happen for a while. They haven't even passed the bill yet. And it does. Recreational marijuana will probably be taxed around 25%. We don't know the exact number yet, but our medical patients, the taxes won't be high. Hopefully, eventually, they'll even do away with the tax. We don't know yet. They'll always get priority medication. They'll always get the more potent strains of medication. So it's just really important. If you have those chronic conditions and you really need your cannabis, don't wait till it goes wreck. Get your
Absolutely. Yeah, and I'm so glad that you brought that up because, yeah, the framework hasn't been put in place yet. Our legislators are still going back and forth. So for the next, we might not see adult use sales for the next few years. So that's a great point, and thank you for bringing that up.
You're welcome. You're welcome.
Here. Thank you so much, Debbie, for introducing yourself and sharing your story on how you got into cannabis. Well, how cannabis found you, actually.
Thank you.
And Preston, are you on the line?
Yes, I'm here.
Hey, so Preston Hall of Cannabis website. I know We were recently talking about CBD, which is crucial to supplement with if you do have inflammatory conditions, if you are in chronic pain. So could you talk a little bit about, what Cannabis is and why would I want to use CBD? And also if you could talk about what's going on in the hemp industry in New Jersey. Can you grow hemp right now?
Sure. So Cannabis is a cannabis coupon website. We have codes for a wide variety of hemp-derived products. These products could be extracts, as we've been talking about all night, or flour. Other ones include clothing, construction materials, all the different ways the plant is derived, therapeutic, industrial, nutritional. Especially with the nutritional, we could get a lot of amino acids and a lot of variety of health benefits from the plant as well. So the reason why you'd want to use Cannabis is because we vet all the products ourselves. We show you different ways to save money, give you updates when latest prices change, because as we've all seen, it's an expensive option to incorporate into your regimen. So we help bring the cost down for you. What's great about it is that we have we can direct you to flower strains to help complement the medical marijuana strains that you do get at RISE and other dispensaries in the state. What's great is, especially when you're using cannabis, you can mix it in kind of like a salad. You can sprinkle in some of the higher CBG strains or CBD right into the THC strains. It's a great complement. Mm-hmm. So yeah, here in New Jersey, we are growing hemp. We have about 59 license holders who secured licenses the first year last year. So it's great that New Jersey is off to we're a little late to the party, but we had a rushed first year and some success. So we learned a lot, and there's going to be good news going forward.
Awesome. Yeah, so it's www.cannabis.com. So if you are looking to supplement with CBD, you can find some great products there.
And the link is in the caption, so it's easy to find.
Oh, thank you so much. Thanks, Preston. So I just wanted to field some questions. I'm sorry we went over. I know it's 7:57. I'm going to keep the chat up. So if you have a question, just type it in the chat and I can unmute you.
I actually have a question.
Sure.
Is Dr. Leonti affiliated with MAPS at all?
I'm sorry?
Is Dr. Leonti affiliated with MAPS?
MAPS. So
no, MAPS. MAPS.
MAPS, the Psychedelics Institute.
Yeah,
so, Yeah, so he's actually, he's working with a bunch of prominent people that are, no, not right, he's not directly affiliated with MAPS. His son, who actually graduated with a psychology program with a focus on using psychedelics for mental health, is. So if you are interested in that, I can definitely link you up with his son. But Dr. Vinny is aware of this. He's learning more about this, and he's definitely someone that is an advocate for using this for mental health, and just like
that is my passion. Psychopharmacology and ethnobotany are my passions, and I would love to link up with him and his son and kind of discuss that further, because I've been researching this individually for years.
So for people that don't know what MAPS is and don't know what we're talking about, could you just sort of drive home what that is?
Sure. So it's the Multidisciplinary Association for Psychedelic Studies, and it's a U.S. founded affiliation. It was founded in the 70s, right after the whole Tim Leary outrage with psychedelics in society. But they were founded with the preface of, basically, if you've ever read The Doors of Perception by Aldous Huxley, or any of the research that Al Hubbard and the likes of Humphrey Osmond were doing in the 60s or in the 40s and 50s when it comes to psychedelics, it's the use of psychedelics in a guided set and setting to induce a mystical experience, to help people with, mystical experience for lack of a better word, but it helps people with PTSD, terminally ill patients who have fear of death, overcome that. I mean, if you know anything about the Alcoholics Anonymous, it was founded on the premise of a psychedelic experience that the founder had in a hospital bed. So the use of psychedelics and entheogens, I like to use entheogens instead of the word psychedelics, right? Mystical plants, holistic plants. But so this is a company that was founded in America to help prolong these studies under the watchful eye of Johns Hopkins, the predominant people who does all the studies for them.
Okay. And yeah, thanks for sharing that with me. And it's I recommend if you are interested in learning more about psychedelics and we're on this movement with cannabis, but that's the third wave. There's a movie called The Way of the Psychonaut, and you can
The Way of the Psychonaut is a documentary about Stanislav Grof, who's one of the founding fathers of MAPS. I actually just finished The Way of the Psychonaut, reading it. But for anybody who's looking for a solid introduction into the world of psychedelics, two very, very good books that kind of are the umbrella introduction for these two, for all this information. How to Change Your Mind by Michael Pollan is an excellent, excellent read. If you haven't read it, I recommend everybody in the world read that book. He's a journalist who's never had a psychedelic experience, heard about MAPS and what Johns Hopkins was doing for 50, 60 years under the covers, and did the research, had the experiences, and wrote an amazing account of it in How to Change Your Mind. He's a New York Times journalist. And then there's another book. It's called The Key of Immortality, and it was just written over the past year, actually. And it's forwarded by Graham Hancock. And if you don't know who Graham Hancock is, he is a genius within himself. But it's written by Brian. Oh, hold on one second. Let me get this guy's name. I literally just finished it. I knew I couldn't pronounce this name without looking at it. Brian Muraseku. And he is somebody who has never done psychedelics before, and he's been studying entheogens and the Eleusinian mysteries in Greece for his entire scholarship. And now he wrote this book in the past year, and it is unbelievable. But I definitely recommend this, The Immortality Key and How to Change Your Mind, first and foremost, for sure, if you're interested at all in psychedelics and what they can provide for our mental health.
Absolutely. I'm glad you brought that up, being that it is the third wave. And just to reiterate with Dr. Vinny, so he's not affiliated with MAPS, but his interest in mushrooms started with functional mushrooms. So there are supplements out there. You're going to see reishi mushroom.
Oh, yes.
Chaga, and you're going to see all these different types of mushrooms that are not the magic mushrooms, but they target inflammation and help and boost.
A company that I recommend for people all the time is Host Defense, founded by Paul Stamets, who is the godfather of gourmet mushrooms and healing mushrooms. And he wrote an outstanding book called Mycelium Running. And if you never read that, I definitely recommend that. It's more of like a textbook, but I'm a big Paul Stamets is unbelievable. I love him and all the stuff he has to say about mushrooms. But yeah, Host Defense is the company that you want to look out for sure.
Yeah. And for those of us that don't know who Paul Stamets is, he's an American mycologist, and he's a wealth of knowledge. So if you have a chance, look up functional mushrooms. There's so many insane studies right now. Most of our medication comes from a mushroom extract, like penicillin is based in mushrooms. There's studies right now that there's certain mushroom extracts that can help with HPV, can help boost men's testosterone. So functional mushrooms, definitely, as you do your research with cannabis, look that up, because it's definitely it's a powerhouse when it comes to.
I would definitely like to get together with Dr. Leonti and talk about this further, because this is something that I've been doing for a while.
We got to do an event. We definitely have to do an event with this. So I did see some questions here. I'm not sure. So we have Regina. It looks like Pat got her answer for where can you get ashwagandha. You said Whole Foods. On Cannabis, there's CBD that has ashwagandha incorporated into it. I just wanted to unmute Pat really quick to see if she had any questions.
Thank you for that.
Mm-hmm. Hi, Pat.
Hi. No, thank you very much for that.
Okay. Any questions? All right. So I see.
Pat as in Patrick, but that's okay, Patty.
Oh, no worries. But yeah, ashwagandha you can purchase at Whole Foods, CVS. They have CBD that has ashwagandha in it. Lazarus Naturals is an awesome brand that has a relaxed blend. So they're they're an Oregon-based company, Lazarus, great brand. And also with any CBD company that we recommend, I wouldn't purchase it if it does not provide lab reports, because we need these companies to be transparent to show that they're testing for the potency for lead, metals, and things of that nature. But moving on to the next question, I saw Regina Davis. We have the same name. Regina asked, what is the best THC for fibromyalgia? Hi, Regina. I'm just gonna unmute you really quick, and I can have Vincent, if he wants to jump back on. And is there a specific strain that patients have raved about for fibromyalgia?
So for something like fibromyalgia, I would recommend something in the way of a hybrid or an indica-dominant hybrid, just because we want to stay functional and aware during the day when we use this, right? Because it's something that's not just affecting you at nighttime, it's something that's going to affect you throughout your day. And because the indica strains tend to target the body more, something that we usually have it, I think we might still have it in the store, Cherry Garcia is a very good strain for fibromyalgia. If we still have it in the store, it's excellent for that.
Okay, thank you.
You're very welcome.
And for fibromyalgia, I know inflammation is a huge problem.
Oh God, yes.
Yeah. So definitely checking. And I'm sorry you're going through that. Fibromyalgia, there's just a whole host of symptoms that come along with that chronic disease. But using THC and CBD is crucial to help with the symptoms and to keep your inflammation levels down.
Okay, all right. Thank you.
Yeah, the good news about these ashwagandha capsules on Lazarus' site, we got 37 5-star reviews on it. So lots of people have vouched for it working pretty well.
Awesome. Does anyone have any additional questions about the products at RISE, the location? Question was for me about Princeton Integrative Health. I know we didn't talk too much about enrolling in the program, but you can go onto princetonih.com, book a discovery session. It's a free 15-20-minute call, and I can walk you through that, how to enroll. Anyone have any questions? No? Give it a second. All right, everyone. Well, this was a pleasure. Thank you so much to Debbie and Vincent for being here. I'm really excited to check out RISE. It sounds like you're doing some awesome things for the cannabis community. And I know Preston and I will be coming to visit you very soon.
I'm looking forward to it.
Yeah, looking forward to it. Thank you for having us. We really appreciate it.
Thank you. And I recorded this whole session, so I'll send it to everyone that registered, in case they couldn't get here tonight, and I'll send information to the participants as well.
Thank you.
And like I said earlier, if you ever want to come in and set up a consultation, we're here for that. Don't think this is the only information that we're going to give you. So don't be hesitant to ask for one.
Awesome.
Exactly.
I just see, it's called it's called Lazarus. All right, everyone. Well, I hope you have a wonderful night and stay warm and be well.